Every one of you, and hopefully your friends and relatives, can become heart attack proof.
Dr. Caldwell Esselstyn Jr., a 91-year-old renowned doctor and general surgeon, has been a pioneer in the plant-based nutrition movement, inspired by his studies of civilizations with lower rates of chronic diseases. Dr. Esselstyn adopted a plant-based diet in 1984, and it has kept him healthy and energetic well into his 91 years of age.
People in Okinawa have been eating for hundreds and hundreds and hundreds of years. They live longer than anybody else. There are no gymnasiums there. When Bill Connor went down to study the Tarahumara Indians, I think there were some 583. 0 obesity, 0 heart disease, and 0 hypertension. But what happens to the Tarahumara the minute they cross the border and start eating our diet?
In our previous video, we explored his nutrient-packed breakfast recipe that supports his vitality. In this video, we'll dive deeper into his teachings and uncover the top 6 vegetables that can help protect against heart disease by enhancing endothelial health. While Dr. Esselstyn prefers getting nutrients from natural foods, he does recommend one specific supplement, which we'll reveal at the end of the video, so stay tuned. But first, let's understand the critical role of endothelial cells in preventing chronic diseases like cancer and heart disease before diving into these 6 must-have vegetables.
It is an endothelial cell, and that is probably now the most important group of molecules that we're going to be discussing today. When you are eating the cheeseburger, the milkshake, the pizza, the first thing that starts to happen in your bloodstream is those cellular elements begin to get sticky. Your endothelial cells get sticky. Your platelets, your clotting factor gets sticky. Your white blood cells get sticky. Your LDL cholesterol gets sticky. When we have endothelial injury and problems, and it just sort of summarizes a lot of the bodily dysfunctions that occur, such as sleep apnea, periodontitis, metabolic syndrome, osteoporosis, erectile dysfunction, cerebral vascular disease, dementia, coronary heart disease, heart failure, sudden death.
Endothelial cells produce nitric oxide, a vital molecule for maintaining vascular health. Nitric oxide is synthesized by endothelial nitric oxide synthase, ENOS, an enzyme in endothelial cells that converts L-arginine, an amino acid, into nitric oxide. Nitric oxide has 4 important functions.
Nitric oxide. Its functions are the salvation and the protection of all of our blood vessels. For example, nitric oxide will keep all those cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. Keeps things from getting sticky. Number 2, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number 3, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed. Protect us from getting high blood pressure, hypertension. Number 4, a safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaque. All 4 are going to be absolutely optimized when you are eating whole food plant-based nutrition. What were these patients going to eat? They were going to eat whole grains, whether it's cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, lentils, and beans, and all these marvelous red, yellow, green leafy vegetables and white potatoes, sweet potatoes, and fruit.
Among these 4 food types, Dr. Esselstyn places special emphasis on green, leafy vegetables, and for good reason. The production of nitric oxide by endothelial cells decreases with age, making it essential to consume foods that boost nitric oxide levels to maintain vascular health.
Endothelial production of nitric oxide is age-dependent. By the time you're age 50, even if you are beautifully healthy, your endothelial cells are now producing 50% of the nitric oxide that you had when you were 25. By the time you're over 80, you've lost 70% of the nitric oxide production from endothelial cells. So, since all these patients with heart disease are so deprived of nitric oxide, I should share with you how we did this, additionally adding 6 green leafy vegetables daily. We need antioxidants, but no, do not go down to the health food store and buy a jug of pills that says antioxidant because it doesn't work and it's going to be harmful. I need you to get your antioxidants from food. What food? Food that is high in what we call ORAC value, ORAC, oxygen radical absorptive capacity. So if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, terrific start. However, nothing is going to trump the antioxidant value of green leafy vegetables. So I need you to chew 6 times a day a green leafy vegetable, roughly half the size of your fist, after it has first been boiled in water or steamed 5.5 to 6 minutes, so it's now nice and tender. And then I'd like to have you be sure to anoint it with several drops of either a rice or balsamic vinegar. Why? Because research has shown us that the acetic acid from those vinegars will restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. Therefore, I want you to chew this green leafy vegetable alongside your breakfast, again as a mid-morning snack. Again, with your lunch and sandwich, that's 3, mid-afternoon 4, dinner time 5, and of course, I adore it when you have that evening snack of arugula or kale. The second benefit from chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do the endothelial progenitor cells do? They make and restore, that is, they replace your senescent, injured, worn-out endothelial cells. Now the third benefit from chewing the green leafy vegetable, and this is most important of all because this is your alternate pathway to make nitric oxide, as your endothelial cells are not doing it as well as you would have liked. So the third benefit is, as you are chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it's going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce that green nitrate that you're chewing to a green nitrite. Now when you swallow the nitrite, it is your own gastric acid, which is going to further reduce that nitrite to more nitric oxide, which can enter your nitric oxide pool. So just think about it. How amazing, with no added expense, no hideous side effects. Literally from morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. What are those green leafy vegetables that Dr. Esselstyn is talking about? They are bok choy, Swiss chard, kale, collards, collard greens, beet greens, mustard greens, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. And the top 6 greens would be kale, Swiss chard, spinach, arugula, beet greens, and beets. Now there is a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, or mouthwash will injure the beneficial bacteria in your mouth. And we do not like patients to take antacids, because antacids will reduce your gastric acidity, and you will not be able to reduce the nitrite to more nitric oxide.
Now we know what to eat. Here are 2 lunch and dinner recipes that Dr. Esselstyn often enjoy.
The sandwich is going to probably have some hummus and some arugula, some other green. Yeah, dinner, depending on some evenings, we have a portobello mushroom with hummus, with some greens, and it's usually on a wonderful hamburger bun, but it's not white flour.
While Dr. Esselstyn recommends getting nutrition from natural foods, here are his thoughts on vitamin supplements.
I do think it's important for the patients to take B12. That's the one that I'm really kind of insisting on, because as we get more senior, and as we lose intrinsic factor in the lining of our stomach and our gastric acid goes down, both of those which are important for helping to absorb B12, probably when over 70, I like people to take probably close to 1,000 micrograms of B12 daily. And it's not like you're going to be overdosing, but you're going to want to be sure that your B12 is safely covered.